Hi, my name is Jamie Perkunis. I'm a physical therapist, and yoga teacher. There are two practices that I've developed to help you with pre-op rehab for your knee using yoga techniques. In these videos, you'll be asked to move on and off the ground. However, if you find that challenging, consider moving to a bed with a harder mattress. In addition to a chair, you'll want to have a wall close to you. You also need a strap and a block. In these practices, it's important to check in with how your body's feeling and make sure that you're breathing throughout the practices. Enjoy the practices. The first pose we're going to start with is seated Tadasana, or seated mountain pose. So you'll want to be sitting in a chair, and you'll want to make sure you have a block and a strap nearby. So you're going to grab your strap and your block, and you're going to place your block medium width between your thighs. Or you can also work with narrow width. So medium width between the thighs, above the knee, and then you're going to take your strap and you're going to wrap it around the outside of your thighs, just above the knee. You can also use a belt or even a robe belt that you can tie into a knot. So you're going to tighten the strap up so that when you press your thighs out into the strap, the block doesn't fall. So if you notice when you press your thighs out, the block falls, tighten the strap up a little bit more. Look down at your feet and point your feet and your kneecaps so they point straight ahead. And place your hands on your thighs and press your feet down into the ground and lift your chest up towards the ceiling. And breathe. Try to breathe in and out through your nose in a slow, calm manner. And then bring attention to the block and hold the block between your thighs, or maybe even squeeze it a little bit as you press your thighs out into the strap. And breathe. You're going to sustain this position for 6 to 10 deep breaths. And then go ahead and slowly release. I'd recommend removing the block first, and then removing the strap. And then we'll prepare to getting onto the ground. So when you're ready, go ahead and rest onto your back. So you move your chair out of the way. And then take your time to make your way onto your back. And then have your strap nearby. You'll scoot away from the wall. And make sure that if you straighten your legs, that your feet can touch the wall with your legs straight. Then bend your knees and grab your strap. And you're going to place the strap around the ball of your non-operative side, or non-pre-op side. And press your knees straight. Try to take the strap in each hand and lower your elbows to the ground so that your upper body is relaxed. We're going for a stretch in the back of the lifted leg. Keep your bottom leg bent, or if you want to increase the stretch, you can extend your bottom foot to the wall. Make sure this is a pose you can breathe in. So if you need to back away, when you find that this pose is really hard to do, come into a position that is comfortable or take breaks. So maybe even lower your leg and then lift it back up if you need. Or bend your knee and then straighten it if you need. Reconnect with your breath. And we'll come back into the hamstring stretch on the same leg. So go ahead and straighten your lifted leg up with the strap. And now take the straps into the same side hand. And bring your free arm out to the side for balance. And then start to bring your lifted leg out to the side to whatever degree allows you to keep your left hip or your non-stretched hip on the ground. And you feel a stretch on the inside of your thigh. If you want more of a stretch, pull your toes up with the strap towards your head more. So lift your leg towards your head more if you want more of a stretch. Make sure this is a pose you can breathe in. Again, consider coming in and out of this pose slowly and resting at any point. The goal is not to get your leg to the ground, but to feel a sensation on the inside of your lifted leg. And then slowly come back to center. Lower your leg to the ground to rest. Reconnect with your breath and just notice the difference between your right leg and left leg. So you'll come back into the hamstring stretch. And this time you're going to take the strap in the opposite hand. And you're going to bring your opposite foot in line with your opposite shoulder. In this stretch, you might feel a significant stretch in the back of your leg. And you can again come in and out of this position. Or you can even work with pointing and flexing your lifted foot. Do your best to keep your breath calm and deep. And listen to your body. If it's too intense, back away, move out of the position, and then maybe come back into it. And then lower your leg to the ground. Reconnect with your breath. Maybe straighten both your legs out and notice the difference between your right leg and left leg. So now we'll switch to the other side. With both legs straight, you can slip your foot in the loop and just switch your feet. Go ahead and bend your non-stretched leg, or the leg you just stretched, so your foot's on the ground. And then lift your leg up with the strap. Try to keep your knees straight. Again, release tension in your neck and shoulders by bringing your elbows to the ground. And also use your leg muscles to keep your leg lifted. We're going for a stretch in the back of the left leg in this pose, but for you it might be the back of your right leg. You can alternate between pointing and flexing your foot, or even bending and straightening your knee. Make sure it's a pose you can breathe in. And then go ahead and lower your lifted leg to the ground to rest. Notice the difference between your left and right side. Reconnect with your breath. And then come back into the hamstring stretch. We're going to take the strap in the same side hand. Bring your free arm out to the side. And then start to bring your lifted leg out to the side to a degree that you get a stretch on the inside of your lifted leg. Make sure that your pelvis stays steady and you keep your opposite hip on the ground. Again, you can come in and out of this pose by bringing your leg out to the side and then back to center. To increase the stretch, you could pull your foot towards your head more. Make sure you can breathe in this pose. And then come back to center. Release your lifted leg to the ground. Reconnect with your breath. Notice the difference between your right and left side. From lying on your back, go ahead and transition to lying on your abdomen. We're going to be using the chair for this next exercise. So roll over onto your belly. So once you're on the ground, go ahead and move the chair so it's behind you and rest onto your abdomen. And then bring your foot to the front of the seat of the chair and let your ankle, the front of your ankle, rest in the front of the seat of the chair. Draw your legs towards each other so that your knee, your bent knee, points straight back behind you. And then press the front of your thighs and even the front of your pelvis down into the ground. If you're feeling discomfort in your knee Consider scooting away from the chair so there's not as much bend in your knee. We're going for a quad stretch here in the front of the thigh. And slowly release, and we'll try this on the other side, which might be different. So we'll go to the other side. So you're going to bring your foot to the front of the seat of the chair. Once you bring the foot in position, try to point your thigh straight back in parallel to the center line of your body. This side might be completely different, so you might notice you might have to scoot away from the chair or towards the chair to change the stretch. Breathe here. From lying on your belly, transition to lying on your back. So take your time to roll over and rest onto your back, nice and slow. Rest on your back with your knees bent and have your block nearby. So grab your block and place it on the outside of one thigh. And then start to bring your knee out to the side, resting the outside of your thigh and shin on the block. Keep the leg that is not stretching pointing straight up to the ceiling to help stabilize your pelvis. You can adjust the block setting to whatever degree you can feel a stretch in the inside of your thigh. Go ahead and flex your foot and breathe. Feel free, like we've been doing, to come in and out of the position. So bring the knee back up to upright, then maybe even open it out to the side, maybe touching the block or maybe not. Make sure that you're able to breathe and stay calm in this pose. And then return to your legs being equal to each other, both knees pointing up towards the ceiling. Now take the block and bring it to the inside of your thigh, between your knees, and bring it to the highest setting. So take the block between your knees on the highest setting. And then walk your foot off the mat and bring the inside of your knee towards the block and squeeze the block between your stable leg and your stretching leg. Flex your foot, the leg that you're stretching. You will feel a stretch in the front of your thigh, maybe even into the outer hip. If you're feeling this in your knee, please make adjustments or come in and out of the position as needed. Keep breathing and stay calm. Consider coming in and out of the pose or sustaining this position if this feels good. Make sure you keep your foot active on the leg that you're stretching, and that you keep the leg that's steady pointing up towards the ceiling. And then walk your foot back onto your mat. Before going to the other side, just notice the difference between your right and left leg. And since we have the block between the knees, go ahead and walk your other foot off the mat. Bringing your knee to touch the top of the block, or maybe even the knee to move lower than the top of the block. Hold the block between your shin of your stable leg and your thigh of your stretched leg. Flex your foot of your stretched leg to keep your foot active. And breathe. Check in with your body and make sure that this stretch is appropriate. So you can come in and out. You can even walk the foot just a little bit out and then maybe a little bit more out. So check in. The stretch should be felt in the hip, not in the knee. And then walk your foot back to the mat. Check in. Notice both the right and the left leg. Notice any changes. And the last one we'll do is take the block to the outside of your leg. And then start to open your knee out towards the block, keeping your stable leg pointing straight up to the ceiling. And this side might be completely different. So you might have to adjust the block. Make sure that the block is a resting place for your thigh, for your knee, and that the stretch is felt on the inside of your thigh. Go ahead and flex your foot on your stretching leg and deepen your breath. And really touch in with what your body needs today. It might be different than what it needs the next day. If you find that you can't bring your knee to the block, then adjust the setting and then bring your knee back up to upright. And check in and notice. Maybe even straighten your legs and see how your hips are feeling. See how your knees are feeling. Stay in this position for anywhere from 3 to 5 minutes, even up to 10 minutes. And make sure you're comfortable.
As you lie in this comfortable position, we'll end by doing a body awareness practice. Start to bring awareness to your pelvis. Feel your pelvis resting on the ground. And from here, bring your attention to your right hip. And from your right hip, drop your attention down to your right knee. And from your right knee, drop your attention down to your right ankle. Then bring your attention to your right big toe, your right second toe, your right third toe, your right fourth toe, and your right pinky toe. Then bring your attention back to your right ankle, back up to your right knee, and back to your right hip. And now bring your attention to your left hip, then your left knee, your left ankle, your left big toe, left second toe, left third toe, left fourth toe, left pinky toe, and back to your left ankle, back to your left knee, back to your left hip. Bring your attention back to your pelvis. This time, we'll bring our attention to both sides of the body at the same time. So bring your attention to both your hips, then both your knees, and then both your ankles. Right and left big toe, second toes, third toes, fourth toes, both pinky toes. And bring your attention back to your ankles, then to both your knees, and then back to both your hips, and back to your pelvis. And from this position, just notice your lower body. And then start to deepen your breath. Start to bring small movements back into your body. Maybe wiggle your fingers and your toes. Rotate your legs in and out. Maybe even point and flex your feet. And then slowly bend one knee up at a time. And gently roll over onto whichever side is most comfortable for you. And return to a seated position. And notice your body.
Thank you for joining me. You can do this yoga practice up to once a day before your surgery. Best of luck in your upcoming surgery, and have a wonderful rest of your day. Namaste.